Today, the European Union began vaccinating the first of its 450 million people across 27 nations. Nearly 2 million Americans have already received the first dose of the vaccine, and over 9.5 million doses have been distributed here. But as CBS's Manuel Bojorquez reports from Wisconsin, most people in rural areas are still waiting.
The rush of vaccines may soon start to trickle into places like Fort Atkinson, Wisconsin, which is tucked away from the big city traffic and noise, but also lacks what other large cities have: ultra-cold freezers needed to store Pfizer's COVID vaccine. Ann Lewandowski with the Southern Wisconsin Immunization Consortium is helping rural hospitals secure doses. Is daunting the right word?
Yes. There will be communities that aren't going to see vaccine in these initial shipments.
In fact, many states have chosen to reserve their limited supply of Pfizer's vaccine for more populated areas. So Moderna's vaccine, which does not require ultra-cold storage, is considered a lifeline. Distribution delays could have deadly consequences. Nearly 15% of U.S. COVID deaths have occurred in rural areas. Health officials in Georgia, Michigan, and Texas are already sounding the alarm about getting vaccines outside of big cities.
In the history of epidemics, rural communities, the epidemic tends to linger longer in the urban areas.
Dr. James Martin is medical director at Fort Healthcare Hospital. Getting the doses is one problem, but so is vaccine hesitancy. A new survey says 35% of rural residents won't take the shot.
Your biggest concern is what going into this rolling out of a vaccine?
Convincing people to get the vaccine is my biggest concern and priority.
All while the virus leaves no part of the country unscathed. Manuel Bojorquez, CBS News, Fort Atkinson, Wisconsin.